Hey, how's it going? My name is Paul, and I want to welcome you to my YouTube channel. The reason I'm starting this channel is to document my Inspire. I just had my pre-op final appointment yesterday. It's July 2024, and I'm scheduled to get the Inspire uh, surgery next Wednesday. So just a little over a week before I go in under the knife and get the implant done. 41 years old. I live in Northern California. I've had sleep apnea, that I know of, that I've been diagnosed with for about 10 years. When I first was diagnosed, my AHI was around 15 or so, and I was able to successfully use the CPAP machine, used it for a couple of years off and on, and was actually able to get some sleep. Sometime before the pandemic, my machine stopped working, and I tried to set up an appointment and tried to get a new sleep study done, establish myself with a new place because I had moved. And of course, COVID had started, all that got kind of thrown for a loop. And I stopped using my machine as it wasn't really functioning well. Didn't really follow up and get a new machine. And then cut to last year, October 2023, I went into my sleep was getting really bad, and I went to a sleep study place. They set me up at home, went home, did the sleep study, dropped it back off, and then when I got the results, I was pretty shocked to find out that in a couple of hours of sleep, I had 154 events. And my AHI, which I had mentioned was around 15, 10 years ago, was now at 29.6. So on that borderline of severe, which starts at 30. And so the longest hypopnea duration was 29 seconds. And I'm sorry, I'm reading this off of here. And my lowest oxygen saturation during that night was 83% during sleep. And, that really freaked me out because, if you think back during COVID, they were telling us anything below 98%, blood oxygen saturation was something to be concerned with. So if I'm sleeping, a couple hours a night and I'm having 29 episodes on average an hour, and at some point my blood oxygen level is getting to 83%, that's pretty frightening. And it said I spent just under a minute with an oxygen saturation below 90%, and 162 minutes of the time that I had slept, that I was in that sleep study. When I was on my back, my AHI was even worse. It was at 48.6, so very severe sleep apnea at that point. And I do sleep on my back quite a bit. In my pre-op appointment yesterday, and some of the questions my wife and I asked the surgeon, about what would happen after I got the implant next week, and how I should sleep and what we should be concerned with. He did mention that I should start sleeping as much as I can on my side, and that I'd be more successful with the Inspire device if I became a side sleeper. So, I asked my wife, do I sleep on my side? Do I sleep on my back? And she goes, well, you kind of move from your back to your side and back and forth. But as this sleep study from last October 2023 stated, I did spend 162 minutes out of 300 minutes that I was being studied on my back. And when I was on my back, that AHI was 48.6. And the AHI that, Inspire and my doctor, ideally want to get to is somewhere between that 5 and 15. The Inspire surgery is not going to eliminate my sleep apnea, but the idea is that it's going to reduce it drastically. And so the assessment, the final assessment from the sleep study, was severe obstructive sleep apnea and mild hypoxemia. And so, obviously that really got me concerned. I had already been experiencing, many months and years of inconsistent sleep. I'd have trouble falling asleep, so occasionally would use sleep medication to get to bed, and then that would just get me to sleep. And then I'd wake up in 2 hours, wake up in 3 hours, wake up in 4 hours, and I'd wake up fully awake. There wasn't anything on my mind that was keeping me from sleeping, except for the fact that my brain was constantly waking me up so that I could start breathing again because I was stopping so often. And between my brain waking me up and my wife shaking me when she'd be awoken by me, not by me having trouble, and snoring, not by me having snoring and bothering her, by me stopping snoring. And so my snoring is so bad that it actually helps her sleep. But when that snoring stops, she'll wake up and she'll shake me and try to get me to either move on my side or really to start breathing again. And so really my sleep has been horrible. It's been horrible for years. And that's really the primary reason why I'm going ahead to get the Inspire surgery. So I'm getting it done next week on Wednesday, going into the hospital at 5:30 in the morning. The procedure should take about 4 hours is what I was told in my pre-op appointment yesterday. I'm going to actually spend the night at the hospital so that they could observe me after the surgery and after the anesthesia, just to make sure everything's okay. Just in case something goes wrong, I live about an hour and 15 minutes away from the hospital where I'm having this done. So I'd rather be there in case something were to occur than to be at home and have to find a nearby hospital or someone that's not familiar with the surgery that I just had at that point. So let me back up just a little bit more. So in order to get qualified for the Inspire surgery, I had to fail at the CPAP, right? And so I did. Back in October, started using the CPAP again, was unable to keep it on for more than a few hours at a time, would wake up with it ripped off my head on the floor or wrapped around my neck in some way, or just really not helping the situation. And so, you start getting those calls. If you're familiar with CPAP and the sleep companies that work with CPAP, they'll start calling you in that first month and saying, hey, you're not using enough. Hey, you're not using it for long enough periods of time. And so I failed at it, right? And I had already started reading up on Inspire at that point. And I was honestly, I was hopeful that the CPAP would work again, as much as I hate wearing it like most people do. But really, I wanted to see if I would qualify for Inspire and if it really was that bad as the doctors had told me after the study. And so it was. So I failed at the CPAP machine. And then I went to the Inspire website, filled out the information. I believe I called them. They recommended a few doctors in the area. I set up an appointment with a doctor that I'm seeing in Fremont, California, and came in, saw him. He looked up my nose, he looked down my throat, and then what we ended up doing, he basically gave me a couple of options. He said, hey, there is the Inspire surgery, which, we talked about and I was already familiar with, but there's also other things that could help, like doing a surgery where he would cut parts of the inside of my nose and the tissue there to kind of make more room for me to be able to breathe through it. He would also do some surgery inside my mouth and a lot of really invasive, horrible things. And if you've talked to a doctor about the other options with failing a CPAP machine, after that sounds horrible. I talked to another doctor and they said they'd shave down part of like your jaw and remove, tonsils, adenoids, things like that. And I'm going, this is way more invasive than what Inspire is offering. And so the doctor set up a pre-op endoscopy procedure, which took some time to get that approved through insurance. That was approved, and that was done a couple of months ago. I think back in April, we did the endoscopy. So that was when I go into the hospital. They put me to sleep. They stick a tube, down my throat. And what they're doing is they're observing what it is that's going on in my throat and with my tongue while I'm asleep, so they could simulate what happens when I try to go to sleep at home. And so what the doctor was looking for is, does my tongue block my my throat and block my ability to bring oxygen in and out of my body, bring oxygen in to my lungs, to my brain, and everything else. And so the endoscopy was successful, and the doctor saw that the movement that he was looking for inside of my throat was exactly the kind of movement and really what they look for to continue to qualify you for that Inspire surgery. And so I was happy to learn that, yes, Inspire will be able to help me, was what I was told. And so it took another couple of months for the doctor to work with the Inspire company, because I'm told they're very involved, to set up the surgery date. Now it's July 2024. As I mentioned at the beginning of the video, we had my pre-op appointment yesterday, asked all our questions. I'm confident with my doctor, and obviously I let him know, hey, I'm anxious, I'm nervous, just like anybody would be for any kind of surgery. I have not been under the knife in any kind of surgery, anytime that I can remember, and definitely not as an adult. And so that's really it. The next video I'll make will be a post-op video. Hopefully, if I'm feeling good enough to do it, I'll shoot a quick video from the hospital of how I'm feeling, what it looks like. Maybe I'll even show you the where the incisions were, or under the neck here, under the chin or the neck area here will be one. Over my right chest will be the other incision, and where the actual unit, the Inspire unit, will be inserted. So I will see you next time. Wish me luck. Please comment, like, subscribe, whatever it is you're supposed to do on YouTube. And let me know if you have any questions. I'll be happy to answer any of them. I didn't talk about insurance or the costs or anything like that, but I'll happy to answer your questions if you submit them. All right, I will talk to you next week after I've had the surgery. Thanks for tuning in.